So we're going to keep talking about advanced clinical practice in relation to how we can take a systems-based approach to this and really work out how we can make this start to happen. And I think to really successfully deliver those high quality services that make the best use of these roles in the right place for the journey of the person who's using those services, your planning of your workforce is really essential. And so we've come up with some useful ways of looking at that might be helpful for you to identify that. One is to look across the place, but also it's really start to zoom out and see what does that journey look like for the person using those services, and whether that's health or care, and start to look at it from the perspective of that point of view, because that really helps you identify what is the thing we're trying to solve with the advanced clinical practice, that level of advanced practice. What difference can it make to the trajectory for the person, the services and where they might sit in that journey? And so we've developed this tool called the patient or service user journey that might be helpful for you to sort of zoom out and see that broader picture. And in that journey, there are often places, the transition points where someone moves into a different part of the health and care system. And that's a point at which it's really possibly more useful to have that advanced clinical practice role to really make that difference. So it's useful thinking across systems and as part of the multi-professional team how these roles can really work and make that difference to population health and need. And thinking that through for your team and sort of starting to plan your workforce, really start to think about what's the purpose, what's the problem we're really trying to solve here. And that would help you start to work out which sort of part of the pathway or what's the need of the population that we're really trying to make a difference to. And if you start looking at your place and what those population health needs are, you can really start to target and look at it, not just from one pathway, but across the system for what that looks like for people. Another part of this is really making sure you've got the right people around the table. It is a process of conversation. If you haven't got the right people around the table, then that really important lens and viewpoint might really make the difference as to what it is you think you're really going to be needing in your workforce. So really collaborating with those people, it might be HR, finance, even talking with your commissioners, talking with clinicians, absolutely, to really start to understand what would make that difference. Looking at it from that systems perspective and thinking about the key principles as well. So what does that look like for learners? How are they going to develop and become that advanced level practitioner? How can they be starting to be part of that workforce system to start to learn the things that they need to know to really make that difference? Thinking about your governance and your assurance, thinking about the fit with the rest of the team. So it's not just a case of picking up advanced clinical practitioners and putting them somewhere. It is really thinking about the fit and the impact for the people using that service to really make that difference to that population. And some of the learning we've come up with, I think, in the ways we've tried to do it across our region and our system, is really knowing that you need to start with understanding what your population need is, looking at your patient pathways, and then thinking about your service. Having someone who's a real champion and understands what advanced clinical practice is, knowing who your workforce is. Who have you got already? Have you actually mapped that and worked out what skill sets they've got and how they could be utilised, maybe in a different way? How could you build their skills and expertise to really build their advanced level of practice? And really understand it's not about creating master's programs or academic programs and sending people away. This is about a work-based learning process of developing your workforce to really meet that need. I think it's also looking at the wider workforce. It might be as part of you looking at this that you realise that that's not actually what you need. It might be that you need other people in your workforce to really start to enable people to function in the way that makes the difference. So it is a process of conversation, collaboration, really working in partnership with all of the stakeholders and particularly the people that use the service. So really have that conversation with them as well. And we've got slide sets that you can see that go with this, and some of those might give you some suggestions as to a process. There are lots of workforce planning sort of modelling tools. You can pick and choose what you like. The key element really is to think your way through that process. What is that I need and what for? What difference will it make? How does it fit with what I've got already? What could I do to develop people to really get in that space to really make that difference? And it might mean working across traditional boundaries, across professional groups, whatever that may be. And all of these things will make a difference for retention and recruitment for your workforce as well. HEE plays a role in terms of enabling some of this. So we have this Jigsaw image that enables you to think about it's not just this person appears, you need educational supports. Thinking about the quality of what you've got and what you need to wrap around and really assure the public that it's safe and it works well. Thinking through your planning your workforce, what intelligence data do you need to plan this? And then thinking about new models of care and transforming your workforce. What could you really do to make that difference, to make a difference to the population's needs and their health and care needs? In terms of the learner journey, thinking about your workforce as learners at all levels of their learning, thinking about how do I develop the next people that would be coming into this space, working across those 4 pillars, how can I develop them and really get them to be in the place where, when I'm going to recruit, I've got people ready to recruit. So in summary, I think advanced clinical practice really does offer a huge amount in terms of offering to the workforce and offering to the population health needs for a place. And I think what we need to really do is make sure that not only do we have to think about how we develop people, we have to think about the governance that would wrap around that to make sure that people fully understand what these people are doing, understand where they sit in that system, and enable them to function to their full potential. And so the governance is a key element of that. We've talked about workforce planning really being based on population need, because that is the starting point ultimately for how our services are designed and the purpose that they're there for. I think a key point to this is really thinking about how you develop that workforce as learners. They are on their journey of learning and development, and part and parcel of planning your workforce is thinking through how you expose people to see that there is a career trajectory for them, that they understand how they can develop and become that advanced clinical practitioner that really can use their skills to the best that they can offer. And so the learner journey concept map that we have on the slides really gives you a bit of a snapshot, I suppose, again a zoom out picture of the fact that there are transition points for the workforce as learners. There are key points where they need to have exposure and learning and development, and that needs to continue all the way through their career. So part and parcel of planning your workforce is thinking about how you do that across that workforce for all of the learners at whatever stage they're at.